Let's go ahead and get started. Thank you for joining us this evening. I'm Jeff Howell, the Executive Vice President of the Missouri State Medical Association, and I'll be your moderator this evening. We are excited to present the second in a series of 6 webinars with the theme of You're a Doctor, Now What? This series is being brought to you by the National Medical Health Collaborative, which is a nonprofit organization established by the Arizona Medical Association, Missouri State Medical Association, and Wisconsin Medical Society. The collaborative has a mission to promote and advance the healthcare field by providing education, policy development, and resources aimed at improving the delivery of patient care. That includes this educational webinar series. If you're interested in learning more about the collaborative, please reach out to any of the medical associations. Tonight's webinar will be focused on the important topic of employment contracts. In just a moment, I'll share some background on tonight's presenter. But first, some housekeeping notes. This webinar is being hosted by Zoom Webinar. You can see and hear the presenters, but we can't see or hear you. It is being recorded and will be available on demand at the end of the entire webinar series, so sometime in mid-November. If you have technical issues, please use the chat feature and we'll do our best to help you out. To optimize your viewing experience, we recommend using a computer to view the webinar. And we encourage you to submit questions via the Q&A feature throughout the webinar. Kyle will try to answer your questions during the presentation rather than waiting until the end. Your questions will go directly to Kyle and will not be seen by the audience. And now let's get started with tonight's webinar. I'm pleased to introduce Kyle Claussen, who will be presenting on the topic of employment contracts. Kyle is the CEO of Resolve and a partner in the law firm Morgan Thieler. He received his undergraduate degree from North Dakota State University, his law degree from the University of Laverne College of Law, and his LLM in tax from Boston University. Kyle is a member of the American Health Lawyers Association and is one of the leading experts in physician employment agreements. Resolve has empowered over 10,000 physicians in their employment agreements, leading to national recognition with various state and national physician societies. Kyle has been featured in a variety of physician-focused media sources, including ZDogg MD, White Coat Investor, Physicians Side Gigs, Physician Moms Group, Beyond Medicine, The Physician Philosopher, and many others. Kyle is married to an ophthalmologist and has 3 children and a dog. Without further ado, I'll hand it over to Kyle.
Awesome. Thanks, Jeff. The one housekeeping note that you brought up, I think is really important. The Q&A component of this is what I would like you guys to focus on the most, especially if this is an educational, session for you guys. If you have questions as we go through this topic, I'd certainly prefer to ask, have you ask them and answer them as we go. So feel free to use that chat or the Q&A functionality. I've got both of those up. I think you guys should be able to see the slides that are there. So we're gonna get started on this. I'm gonna take my video down, but we'll bring that back at the end for questions. So let's get going. The first thing that I want to talk to you about with this topic particularly is the understanding of what the market looks like for you guys today, and whether you're in med school and in training, or if you're even out in practice right now and you're just thinking about taking a new position and looking at a different job or a different contract. There's really 3 things right now that make the market unique, in my opinion. So we've been reviewing contracts and doing this for over a decade. There always has been a shortage of physicians. And so that certainly plays into the topic of leverage and the topic of what your options look like as you're starting to think about contract terms. And so understanding what that looks like is really important. The statistics are somewhere between 37,000 and 124,000 physicians that we're going to be short by 2034. Okay. And so that certainly, again, leads into the topic of supply and demand, which we're going to get to here in a second. But the second thing that's happened, and this has been more recent, the last 2 to 5 years, is there's been a heavy move to employment, right? So historically, physicians had been, primarily in private practice. Practices were tended to be smaller, right? You were joining colleagues. And now the statistics are roughly, 75% or more of physicians are employed, right? Meaning you're working for large health systems, academic centers, or, even potentially private equity groups that are owning, a lot of these physician practices that are out there. And so I'm not here to say whether that's good or bad necessarily for you guys tonight, but I do think it's a topic that you need to think about as you're thinking about who you're negotiating with now versus who you were negotiating with, maybe 10 years ago. Okay. And the third factor today is that, the topic of burnout, right, and stress and kind of career satisfaction has certainly been a priority and been well documented. A lot of the clients that we're seeing now come through have different priorities than they did 10 years ago. And so when you're thinking about what you're after in a contract, all of the things non-compensation related, we're going to talk about some of those issues and trying to spot things that could give you problems outside of just the numbers in a contract, and making sure that you're finding whatever priorities are important for you, that you're keeping those top of mind and able to spot those issues, because everybody has different priorities as they look at jobs. Okay, so a visual of what the market looks like right now is, I like to view it this way: is there's a difference between how much control you're going to have, right, in a practice, and how much guaranteed compensation they're going to provide you or pay you up front. Okay. And so the dichotomy looks a little bit like this, where hospitals, health systems, right, anywhere where you're an employee, there's no chance for partnership or ownership, usually comes with more guaranteed money, right, meaning less risk to you, but there's also less control and less upside. Okay. Anything that has more upside, more autonomy, more ancillaries that go along with it, surgery centers, right, other things that you can buy into that'll drive ancillary revenues, almost entirely going to be in private practice, usually more risk, usually, lower guarantees. And so when you think about 75% of the market now being that employed model, right, most of your dots are going to fall into this upper right-hand quadrant somewhere. Okay. And most of your private practice positions are going to fall into this lower left-hand somewhere. If you can find something that gives you a lot of upside, a lot of autonomy, and a lot of guaranteed compensation, is that a unicorn? I'm not sure that it's quite that rare, but certainly that would be more favorable, right, for you as you're looking at your offers. And then vice versa. You really shouldn't be looking at anything that has low guarantees, no control, no upside, right? If all of those factors are not in your benefit, not in your favor, you certainly should be able to find other offers that are out there. So again, this isn't a perfect, right, model. It's not a perfect visual, but it gives you a concept of what you should be thinking about as you start to review your offers and what your strategy should be as far as how you move through a contract review and how you move through a contract negotiation. I'd like you to think about these 4 areas, and we're going to talk about the last 3 here. But the first thing that I want you to do is identify your individual priorities. Okay, so usually the clients that come to us are either valuing geography, meaning I have to be in Denver, I have to be in New York City, I have to be in San Diego, right? And so they've identified that location is most important to them, or it's compensation. They're trying to maximize base salaries, maximize student loan forgiveness, right? Maximize signing bonuses for some reason, for cash flow needs, or they're really focused on scope of practice and time, right? Maybe it's that they don't want call. Maybe it's that they only want to work 4 days a week. Maybe it's that they only want to do certain types of cases or see certain types of patients. Maybe they only want an outpatient setting. All of those things are going to be specific to you. And again, there's no right or wrong answer on any of those things. Those are not things that are for me to decide or anyone else. So we're going to skip that for tonight, but it is important and it is helpful when clients come to us with a clear understanding of what their priorities are. Okay. So if you can do that early in the process, that'll help you review offers, and it'll also help you when you get to, time to negotiate and decide what's most important to you. Okay. So the second thing is, once you've identified what's important to yourself, you need to know what the market data looks like, right? So there's different ways we can look at market data. There's some survey data, there's some crowdsource data, there's some other offers that you can take a look at. We're going to take a snapshot of all those and let you guys see what that looks like. But you have to know what fair market value is before you can start to evaluate what you've been given by an employer, right? You need to compare offers. You need to know what terms to review, what red flags are out there, what to look for. And that's obviously the goal of tonight's webinar, is to educate you on those items. And then finally, you need to negotiate, right? You need to be able to understand how to negotiate, when to negotiate, what the likely responses are going to be from the employers. And so we're going to walk through that as well. Okay, so that's kind of the outline of where we're going. All right, so the first thing that we're going to get into with some detail is market data. Okay. So when we think about market data, one of the things, if you are in practice right now and you've had a contract, employers generally will reference some type of survey data in their contract, and there's compliance reasons for them doing that. If you've ever heard of Stark, or if you've ever heard of them being concerned about IRS fair market value requirements for being a nonprofit, they're likely going to be referencing one of these surveys in the left-hand column, whether that's MGMA, AMGA, AAMC, Sullivan Cotter, or some of the other ones that we're listing out there. You'll frequently see language that says something to the effect of, we can't pay you, right, more than the 75th percentile of the survey or more than the 90th percentile of the survey, right, without some type of discussion, because they're hoping that that language will save them from an audit or from a violation, if there is an audit, right, of those laws that we talked about. If your contract that you're looking at has these surveys referenced, I think it'd be really, really important for you to have access to the same surveys, right? You should be able to compare apples to apples as much as possible. All of the surveys are relatively close, right? With their numbers, they might vary or deviate, 5%. But in any event, those are surveys that are compiled, from employer submissions, right? And they're utilized for compliance. So it'd be really important for you to have access to those things. Your second source of information is what we're going to call crowdsource data, right? It's information from your peers, from your colleagues, from real contracts that they're looking at, that they're reviewing. And you can go on to sites like ours, like Resolve, and take a look at what's being offered in the market, right, for your services. And you can see things that are not just going to be focused on comp, but you can also look at other things like malpractice insurance and tail coverage and non-competes, and the things that the surveys in that first column don't have, you're going to be able to find from a crowdsourced, set of data. Okay, so that's your second set that you should look at. The third set that is going to be your best data point, and this is what I'm going to encourage you to do anytime you're looking at a contract, is to make sure that you have at least 2 or 3 offers in front of you that are viable, meaning you're interested in 2 or 3 of them, right? So it does a couple things for you. One, it's going to show you real time, live market information of what your services are worth at that point in time. So if you're going to move to Phoenix and you're an ENT physician, right, and you've reached out and talked to all the ENT practices and you know that 5 are hiring right now, that's the type of information that's helpful for you when you're negotiating, versus if all you've done is taken one, right, job posting, you have no idea who else is hiring, it puts you in a little bit of a bind or a tough spot of knowing what to negotiate and how hard to push. Okay, so make sure you have other offers. It'll allow you to compare the market side by side better than either of the other 2, even though both of the first 2 columns I think are still useful and still beneficial for you. Okay, so once you've taken a look at the data points, right, the next thing to do is to say, okay, I've got this ammunition, I've got this information behind me, I've got a document now in front of me. What should I be looking out for, right? What are the most important things that are going to potentially cause me problems down the road? And I want you to think about these into 3 categories. Okay, so there's 3 columns here. The first one I want you to think about is what I'm going to call the job, right? The scheduling, the duties and responsibilities, where you're going to work, all of those things. Okay, so most contracts are going to start out on these topics being very vague and very broad brush, meaning it may say that you work at any location, right, that the employer deems reasonable. And again, historically, if we think about you working maybe in a private practice that has 1 or maybe 2 locations, that's probably less of a concern for you. Today, if you're joining a health system, obviously they have multiple, if not hundreds of locations. And so I think it'd be really important for you to detail what that looks like. Same concept on which days of the week you want to work, if you're going to take call or if you're not. Okay, all of those things affect lifestyle, right, and career satisfaction. The second 2 things that I want you to think about in the duties and responsibilities is, what am I allowed to do outside of this contract? So a lot of physicians now have side gigs, they have outside interests that they want to work on, whether that's the practice of medicine, meaning moonlighting, consulting, or whether that's doing things like being an expert witness for legal, or if you have a social media site that you run, if you have a blog that you run, all of those things fall into outside activities. And most contracts are going to start out saying that you're not allowed to do that, right? Unless they've given you permission and potentially There may even be some revenue share components that go into that if you don't go in and ask for those things changed, right? And so outside activities and intellectual property that you're creating while you're an employee may not be issues for all of you, but if you do have concerns on those things, definitely information to pay attention to, right, in the document. The last two things in this category that I'd have you pay specific attention to are whether or not you're required to supervise APPs, right? Physician assistants, nurse practitioners. If you are required to do that, are they paying you for that or not? Again, most contracts are going to start out with some very broad language on that topic, and most of the clients that we speak to have very strong feelings about that one way or the other. And so I think it'd be in your best interest to get that detailed and defined for your preferences. Okay. And then if there's any need for time allocation, specifically if you're in an academic center for research or teaching, and if you're not, just admin time in general, most places are going to allow for somewhere between a 0.1 and a 0.2 FTE status for those administrative and other, kind of components of your job. Okay. And so if those aren't detailed well, again, the recurring theme here is get the details down that are important to you. Okay. So that's category one. The second category that you want to make sure you're paying attention to is compensation. Obviously, you want to be paid fairly. You have access to those data sets that we talked about before. And so the things that you should be looking at in the categories under compensation are going to be as follows. One, base salary and production are in 90+% of the contracts that we look at. Okay. And so if you don't have any type of guarantee in place, or if there is no production bonus that ties into that, that would be a rare situation. Make sure that your base is a true base, not just a draw against future compensation. And what I mean by that is if there's, let's say a work RVU system in place, and we're going to go through a comp example here in a minute, but if you have a work RVU system in place and it says you've got to get to 5,000 work RVUs before you bonus, you want to be also careful that, if you don't get to 5,000, your base is still there and it's not just a draw that they could potentially reduce, right, if your production doesn't meet that level. Okay. So take a look at the comp structure. Almost all contracts now have some type of signing bonus and relocation allowance with them. I'd be surprised if you didn't have an offer with at least one or both of those things included. You'll need to be careful on that because there are some repayment obligations that are usually going to be tied to those things. And we're going to talk about that in the next column here. But in general, right, the principle is the longer you're willing to commit, the longer you're willing to stay, the more of these ancillary items and additional compensation items that are going to be available to you. All right. Along with signing bonuses and relocation, the other things that you might see are student loan forgiveness, residency and fellowship stipends, meaning they're paying you while you're finishing training. Retention bonuses are a little bit more rare, but it's something that's almost akin to a signing bonus. It's just a payment for every 12 months, kind of a carrot for you to stay on and not to leave and look for something else. Okay. You'll see there's one in the middle here that I skipped, which is quality. Many contracts will have a quality component to them. However, and that's, I think, the trend, right, is we're hoping to see more of that, or at least, the policy is that we're hoping to see more quality components. We're still not seeing that reflected in a high level of contracts, though, okay, and a high number of contracts. So if there is a quality component to your compensation package, usually you want to limit that to, 5 or 10% of the total comp, and not something that runs beyond that, because most of our clients have concerns on the factors that go into quality. And because they're so new, they haven't been defined well. There's a committee that usually sits over top of some of that, patient satisfaction and some of those things you can't necessarily always control. And so trying to, limit the total percentage of your comp that's tied to those things is usually beneficial for you, at least at this point in time, until the details get flushed out a little bit better. Okay. And then other things that you're going to see in the compensation section of a contract would include benefits like CME time and allowances, vacation time and allowances, health insurance, retirement plans, et cetera. Some of the language you may see will say that they can modify their benefits from time to time, as they see fit. And that's, obviously not to your benefit, and you want to be careful on that. However, some of the benefits that they have are going to be group benefits, meaning the health insurance, the retirement plans. When they make decisions on those items, they can't discriminate and offer, a retirement plan to you that's different than they're offering to the other people in the pool. And so that's one of the topics we'll hit on here in a minute about negotiation, is knowing how and when to negotiate for certain items, because some items may end up being non-negotiable, like retirement and health insurance. Okay. All right, and the third category of issue spotting for you is anything that revolves around termination. Okay, so worst case scenario planning is really important. You know, family law attorneys will joke about planning the divorce along with the marriage. It's the same thing you want to think about in a contract. You want to think about leaving the same time you're entering it, because unfortunately life happens, you know, things change. And so knowing how the contract can terminate is the first thing I want you to think about. Okay. So it's usually you're going to be able to terminate either for cause, meaning there's a breach of contract somewhere, the employer did something wrong, or you can terminate without cause. Okay. And a without cause termination is the most common. That's how probably 95% of all contracts are going to end. You didn't do anything wrong. They didn't do anything wrong. It's just time for you guys to move on, move different directions. Okay. And so in that situation, understanding the notice period of how much time you have to give is really important. And then how that has to be delivered, whether it's in writing, whether it's, you know, certified mail with signature, you know, there's different requirements in each contract of how you have to do that. Most commonly, you're going to see between 2 and 4 months of a notice period that's required. And so if that's something that makes you uncomfortable, if you want a longer notice period, because you got to remember this cuts both ways, meaning they only have to give you 60 days notice as well if they want to go a different direction. Those are things that are very personal to each client. And so it's something for you to think about as far as what you'd be okay with. Okay. So once we know how the contract can terminate, the next step is to take a look at what are the ramifications of that. Okay. And the things that I want you to think about: one, any type of financial obligation that you may have to them. So repaying those signing bonuses, repaying those relocation allowances or student loan forgiveness. That's going to be important. Deciding on who pays for tail coverage is a real cost to you. And so if you have a contract that you've entered into and the employer has a claims made policy, meaning it covers you for claims that come in right while you're underneath their employment, but it doesn't cover you for claims that come in after the fact, that's when you need tail. Okay. And so knowing who pays for that is really important, and when they pay for it, because there may be exceptions to, you know, when it's the employer's responsibility versus when it's yours. Okay. And then finally, if there's a non-compete in your contract, and we've got a whole slide on this that we're going to talk about in a second, but if there's a non-compete in your contract, those are things that can really do damage to you from two sides. One, if the relationship fails and you have to leave, you know, they may prevent you from working in the area and an area that you have to be in. And two, if you're just trying to renegotiate, right, they can also kind of hang over you during that negotiation, because if the negotiation fails, you may not have another option, because you can't, you know, terminate and then work right somewhere that's close by, or somewhere where you may have another offer. So we're going to talk about what non-competes look like with an image here in a second. And then some of the other ancillary things that I'd have you pay attention to: making sure you have access to medical records if you need them for things like licensure or board certification, really important. Making sure that there's not any type of liquidated damage clause in the contract. And liquidated damages just means that there's an automatic calculation, right? If there's a breach of contract, if there's a violation of the non-compete, if you terminate without proper notice, right? Any of these things that happen, there's an automatic calculation saying, even if, you know, we can't prove damages, which is the general rule in contract law, even if we can't prove damages, we expect you to pay us 50, 100,000, right? 200,000, whatever the number might be that they put in the contract. Those can be really problematic for you, because again, it's something that shifts the burden of proof to you to say, hey, I'm not in breach, right? And I'm not responsible for paying that amount. Okay. So be careful on liquidated damages. And then finally, something that's new ever since COVID is force majeure clauses. So force majeure clauses were very common in things like construction contracts. And so force majeure means that if there's an act of God, things like hurricanes, tornadoes, fires, and pandemics, right? Things like that fall into these categories that are beyond the control of the employer, that they don't have to follow through on the contract. Okay. Again, this is something new since COVID. We never saw them historically. In the last, year and a half, they've started to show up in physician contracts. I don't think that there's much benefit for you having a force majeure clause in there. What we saw happen during COVID is that employers were, unilaterally cutting pay, right? Furloughing physicians or letting people go without proper notice. And so if there is a change, right, in circumstance, which happens in all business, and they have a termination period that they can give you on a without cause, our preference is that they utilize that and not utilize an immediate termination, right, for something that you have no control over. And even beyond that, trying to define, I think, when a pandemic is happening or not, or when it's over or not, is again something that you shouldn't be leaving up to, right, the discretion of the employer on when they can enforce your contract and when they can't. Okay, so try to remove those clauses if you can, in addition to spotting, all of these other issues as you go through it. Okay, so with that being said, we are going to take a look at compensation specifically, and I want to walk you through 3 different models that you might see or that are most common for you to see. So when you have a comp model with production, you're likely going to see it based on work RVUs, which is column 1 here, or based on collections, which is column 2. Occasionally and more rarely, you may see it on gross charges or billings, which is column 3, but by far and away, the first 2 columns are the most common. Okay, and so I want to walk you through how to analyze comp and how to make sure you're being paid fairly for what you're doing. And we talked about having access to fair market value data, right? Whether it's through the surveys or through the crowdsourced information. Okay, and so when we talk about medians on this table, the medians are coming from those data sources, right? So whenever you go out and you get this information, you're saying, okay, if I know in column 1 that the median compensation for my specialty is 200,000, and I have a contract in front of me with a base that's also at 200,000, right? This is column 1 that we're looking at on work RVUs, and I'm in a work RVU model with this employer. A lot of our clients stop their analysis at that point and they say, okay, great. They're offering me 200. I know the median because I've checked the data is also 200, and great, right? The problem is that if you don't go further and check the productivity and understand what that looks like, it may not be a fair structure. And so if the median for this specialty, for this location, says that 2,500 work RVUs is what equates to that $200,000 compensation number up top, and your contract has a threshold of 3,000, to me, that looks like they're asking you to work or produce an extra 500 work RVUs without being paid for it. Okay, and so if your multiplier, your dollar amount, your conversion factor per work RVU is $40, 40 times that 500 difference is $20,000, a $20,000 deficit or $20,000 gap. So in column 1, to me, it looks like, right, that you're being underpaid by 20,000. And you can utilize that same type of analysis, the comparison of the median to the comparison on the production side to see where it falls. On collections, it's the same type of analysis. It's just the numbers are a little bit different. So let's walk through column 2 here for a second. If the median, now in this location is 190, you've got a base offer of 200. You might think, great, right? I'm actually positive 10, right? I'm up 10,000 from where I should be. They're being aggressive with their package. But if you go and look at the production requirements and it's asking you to produce $600,000 worth of collections, and the median is 500,000, and the median multiplier is 30%. Well, 30% of 100 is, right, 30,000 that you're short on the production side. And if you're positive 10 on the base, right, you're still down 20 total. So in both the first 2 columns, you're down 20,000 or short 20,000 from what I believe fair market value looks like or should look like under those contracts. And so how do you go about fixing that if this is the contract offer that you've received? It's either, right, that you ask for an increase in base of 200,000 or of 20,000, or you reduce the production threshold to the median, right, from 3,000 to 2,500. Or if it's a really high volume practice and you're going to blow away past that 3,000 number anyway, potentially you can increase the multiplier, right? So there's kind of 3 different levers there that you can push on or pull on, right, to increase the compensation and make it more fair. It just depends on what your priorities are, what your goals are, what the practice likely has for you in volume, and any and all of those would be okay adjustments as long as you get back to something that looks like fair market value. Okay. If there's questions on that, please throw them in the Q&A or in the chat feature. Okay, we're going to go on to the next slide here for a second. The next thing I want to walk you through specifically is non-competes. Okay, And this is a visual of an example of a non-compete that you may see that says, once this contract terminates, you're not allowed to work within 2 miles, right, of any of the facilities that we have. And if you gloss over that and all you read is 2 years and 2 miles, you may think, fine, right, if I have to move 2 miles away, it's not a big deal. However, if you're in a health system and they have multiple facilities, right, all over a metro, it's likely that the map is going to look something like this picture, where you've got 2, 3, 4, 5, 6, 7, maybe circles, right, all of 2 miles each, and effectively turning a 2-mile non-compete into something like 20 or 30 miles, right? So you've got to be very careful on not only the time, whether it's 1, 2, or 3 years of time post-termination. You also need to be careful in the restricted area and trying to push that, 2 miles to 1 mile or 20 miles to 10 miles, right? Whatever it is, trying to shrink the radius. But you also need to try to limit it to the primary practice location, or at least the main location that you're working at, and potentially put in some other exclusions for, things that aren't your fault, right? So in the COVID, force majeure example, if they have to let you go without cause, right, or because it's, because there is a force majeure event, in my mind, that would be a good reason to release me from the non-compete as well. Or if you're in breach of contract, right, you can no longer pay me and I have to walk away from the situation. It also seems, inequitable to say I can't go to work wherever I want to, right? So you're trying to, one, remove them entirely if you can, right? Nobody likes a non-compete, but if you can't remove it entirely, you try to limit it as much as possible to give yourself some options and give yourself some outs, right, post-termination. Okay. The last thing I want to talk about before we get into questions is just negotiation in general. Okay. So how do we negotiate and what we negotiate is really important. Okay. Now, I think that a lot of our clients get worried about offending the employers, that they feel like negotiating is not something that they should be doing. If that's a situation you're in, I can promise you it's extremely common to not accept the first offer. I think you need to be careful not to negotiate in bad faith, meaning you should be asking for things that are important to you, right? You should be asking for things based on some objective reference, whether that's fair market value from a survey or from another offer that you have, right? And things that are important to you personally. And I think it's also important for you to have this concept of BATNA, right? Of what's my best alternative if this doesn't work out. If you have that mindset before you go into the negotiation, I think you'll be much more successful, okay? And so the negotiations that I've seen personally go south or go bad are ones where usually the client is asking for things that are outside of the scope of what's reasonable. 2, they're not asking for everything at once. They're piecemealing the negotiation, and no employers that I'm aware of like that, right? They want to, if you've got 10 requests, they like to know all 10 of those requests at once. Okay. So try not to negotiate comp and then come back and negotiate the non-compete and then come back and negotiate call, because at some point they're going to get frustrated and not know when the last request is coming in. Okay. So ask for everything that's important to you, ask for it all at once, make sure you know what your alternatives are, and then understand that their very first response is probably going to be something like, all of our contracts are standard. This is the same contract that everybody else has signed, right? We just had a fellow come out last year that signed this, something to that effect, right? That being said, even though when you hear that, over 85% of the contracts that we see some type of change in them. And I'm going to show you an example of language from an email from an employer, from their legal counsel, on one of the clients we were dealing with, to show you how this looks. Okay. So the email we got back said the contract we offer to Dr. X is the contract we offer to all of our employed physicians, and it's been reviewed and vetted, right, by scores of attorneys over the past 15 years. We typically don't make changes. And then the but right in the middle of the paragraph, that being said, we did actually change the non-compete for this physician because we were advised it was important for him. So you can see the hypocrisy to some extent, even in that paragraph, is that, this is a great contract. It's been vetted hundreds of times. You shouldn't have any issues with it. I'm not sure why you're asking these questions. That being said, we are going to change it for him, right? And why is that? Because of supply and demand, right, in general. So if you have multiple options, which you should, because there's a shortage of physicians, if you've done your homework, you know what's reasonable, you're not asking for something that falls outside of the normal parameters, and you're doing that in good faith, I think you can feel very good about making the request. Doesn't mean that they're always going to say yes to everything, right? They may say no to 6 of the requests and say yes to 4, but you certainly should be in a position where you feel empowered to do those things. Okay. So with that being said, I'm going to turn it over to any and all questions that you might have. If you feel like you have questions that you don't want to ask in the chat or in front of the group, my email is on here as well. It's kyle@resolve.com. I'm happy to answer them that way, whether that's today or tomorrow. And yeah, we'll go from there. So any questions that I can answer for you?
Kyle, why don't you, if you don't mind, why don't you go through where they can find that compensation data again?
Yeah, so I'm gonna go back to this slide here for a second. So these are the different categories, right, of the compensation data. One of the things that you should be looking for is some combination of all 3 of these things, okay? And so if you, one, I guess if you go to our website as a starting point, you're gonna be able to access this crowdsource data. And if you're a paying client of ours, you're gonna have access to MSMA data, okay? And so there are spots out there for you where you can get a combination of this stuff together. Obviously, your other offers, right, and your best data point is one that you're gonna have to kind of hunt down on your own, right, and interview and get those hopefully in front of you. But other places you can look for this. Sometimes your program directors may have access to it. There are, historical surveys that you may see online, right? If you're Googling these things, I would be really careful on that. The trend lines in physician comp are going up, right? So if you find something online from 2018 that somebody's posted, right, even though they're not supposed to, because it's a licensing violation, you may be shorting yourself 10, 15, 20% because you're not getting the most up-to-date information. So I would try to find access to something that's current when you're looking at comp.
There's a question in the chat.
Oh yeah.
Are there any negotiations that can happen at all when you match for residency? What about fellowship? Thanks for the presentation.
Yeah, no, you bet. No is the answer on the residency and fellowship. Not that I've seen anyway. Those are very straightforward, right? There's some funding, options there that are kind of mandatory. And so no, I've not seen a fellowship unless it's an unaccredited, right, fellowship that you're doing somewhere where somebody really wants you to come in. Potentially that might be a little bit negotiable, but for the most part, no, we're talking about contracts that are post-training.
There's a couple in the Q&A. Do you have any resources you would recommend to learn more about the different aspects of contracts without having to go to law school?
Yeah, law school is your best option. But that's an expensive route though. So Jeff, do you mind if I just show them what's available for free on Resolve? Are you okay with that?
Sure.
Okay,
yeah, that's fine.
So from a reference standpoint, okay, so this is our website. You can go to this contract education page as a starter. And if you're looking at certain states, right, every state has different information as far as like, California, right? You click on that. California doesn't actually allow non-competes for doctors, right? We will show you kind of what the tort reform limits are, licensure issues, telemedicine laws, all that stuff by state. You can also, if you are wondering just what I should be looking for in a contract, there is this free scorecard you can go check out as well, where you can pick your specialty, right? And you can say, okay, what does a work RVU, bonus rate look like? Is $50 good or not? Is $5,000 a year from a production standpoint okay or not? And so you can kind of walk through all of this and get a general idea of what, might be okay and what might not be okay. Those would be starting points for you. I mean, I read as much as you can on this stuff, but law school, I would discourage you from doing. So.
Okay. Next question from, how much should one expect to spend on crowdsourced resources?
Okay, we're gonna go back to this for 1 second quick. So the crowdsourced information right here, some of this is free on our website. If you want full access to it, the pricing is up here. You can go check that out. Ours is $200 a year. It's not a very high priced item. If it's more or much more than that, I would be careful on how much you spend for it.
Cool. Let's see. Let me ask you a question about renegotiation real quick. When it comes time for renegotiation, first of all, how often do employers do that? And secondly, are there any particular issues with renegotiation that aren't, as obvious the first time around?
Yeah, so most contracts that we see have some type of term tied to them, whether it's a 2 or 3 year contract. But the reality of those are that because they have this termination without cause component to them, so you can have a 3 year contract, for example, but if this notice period that we talked about is 60 days and you can exercise it at any time, you really have a 60-day contract, right? You have a 2-month contract that's constantly renewing because in theory, on day 2, you could go in and turn in your notice if you wanted to and still be in compliance with the contract, right? It's not a breach to do that. So you can renegotiate at any time is what that means, right? And I can promise you when employers have changes in fee structures, right? Like what happened this year in 21, there was some pretty drastic changes. We saw a lot of amendments getting passed out mid-contract from the employer side. And so I would tell you, anybody that's listening to this, you should be constantly evaluating what fair market value is, because if you see a big bump, right, for some reason, because supply and demand change for your specialty or because reimbursements increased, you should be asking for that change prior to your 3 years expiring, because they're gonna do the same thing back, right? I mean, everybody wants to be at fair market value, or better, all the time.
Cool. Well, it looks like we're out of questions. So Kyle, I want to thank you for taking the time to speak with us tonight and sharing all that information. And if you want to throw your email back up there, perfect. Great. So there's Kyle's email in case anyone on the webinar wants to reach out to him. To those on the webinar, thanks for participating. You can, next week, we're going to be talking about job search and interview tips. So for those of you that are interested in that, you can go to msma.org/events and sign up for next Sunday night's webinar. So with that, we'll call it a night. Thanks for everyone's participation.
Thanks, guys.